My name is Cindy Kathleen Kalidukan, and I'll be presenting Rubella virus. Rubella virus is the pathogenic agent of the disease rubella. It is also called German measles because the first case was first discovered in Germany in the 1740. It is the only member of the genus Rotavirus that belongs to the family Tugaviridae. It is enclosed in an envelope and contains a single-stranded, positive sense RNA. It is about 55 to 89 nanometers in diameter, is spherical in shape with an icosahedral capsid symmetry. The capsid consists of multiple copies of one virus-specific protein surrounded in a lipid bilayer containing two virus-specific glycoproteins. The only known reserva is human. Rubella virus is intracellular parasite, obligate needing a host cells to reproduce. It cannot reproduce by itself. It can bud within the cytoplasm of cells, and so it is protected from the host's humoral response. It has a half-life of an hour at 37 degrees Celsius outside of the host, and the mean survival time is 0.9 days. Rubella is a viral illness that can lead to complications and death. About 25 to 50% of the infection is asymptomatic, and if it occurs during the early pregnancy, it may cause miscarriage, fetal death or stillbirth, and severe birth defects known as the CRS, or congenital rubella syndrome. The common congenital defects are hearing impairment, heart defect, and cataract. Rare complications in adults are encephalitis, or the inflammation of the brain, and thrombocytopenic purpura. Symptoms and diagnosis. It is characterized by maculopapular rash that starts on the face, and it gradually spreads to the feet within 24 hours and may last for about 3 days. The rash starts around 2 weeks after exposure to the virus. Other symptoms include fever, lymphadenopathy or enlargement of the lymph nodes, and flu-like symptoms such as coughing, sneezing, and sore throat. The diagnosis is confirmed with serological testing, and the common methods used are enzyme-linked immunosorbent assays or the ELISA, hemagglutination inhibition test, and immunofluorescent antibody assay. Who is the host? It occurs worldwide, and populations affected include the host's access to socioeconomic and healthcare conditions, like access to the rubella vaccine, especially to the individuals living in the rural area in the poor countries. The infection peaks in late winter and spring. Before the introduction of the vaccine, children between 5 to 9 years old of age and pregnant women who are not vaccinated with rubella before getting pregnant are at risk of getting the virus. High cases of CSR were found in Africa, Southeast Asia, and Western Pacific. According to CDC, rubella is no longer endemic or constantly present in the United States, but it can still be brought into the U.S. by people who get infected in other countries. The virus is transmitted by aerosols from the respiratory tract of an infected individual. Transmission may occur via nasal and respiratory tract secretions, carried on hands that come in contact with nasal mucosa, like when someone sneezes, coughs, or talks. A study also suggested that it can be transferred from an uninfected infant's urine or blood. Infected pregnant women may transfer the virus to their unborn babies through their bloodstream. Rubella virus can be avoidable by not going to places that are at most risk of the virus, getting the rubella vaccine, or it's called the MMR vaccine, and good sanitation practice. MMR vaccine protects against 3 diseases: mumps, measles, and rubella. CDC recommends children to get 2 doses of the MMR vaccine, starting with the first dose at 12 through 15 months of age, and the second dose at 4 through 6 years of age. Pregnant women who are infected with the virus may be given antibodies called hyperimmune globulin that can fight off the infection, but this will not eliminate the risk of the unborn baby getting the congenital rubella syndrome. There is really no specific treatment for the virus other than supportive. It can be managed with bed rest, good hydration, and medicines for fever such as acetaminophen. And doctor recommends isolation from others, especially pregnant women during the infectious period. Thank you.